Good afternoon, everyone. It's 2 o'clock. I'm just going to give it a minute to allow for time for others to join. All right, let's begin. Good afternoon. Happy Friday. Thank you so much for taking time to join the Long COVID Town Hall. Before we begin, I would like to do some brief introductions. So for starters, my name is Alicia Merchant. I am the epidemiologist working with the Healthcare and Mortality Investigation team. In addition to myself, we have our team lead, Charles. Would you like to introduce yourself?
Good afternoon, everyone. Again, my name is Charles Cager. I'm the epidemiology liaison team lead, and been with the county since August of 2020 at the outset of the pandemic.
Thank you, Charles. Do we have Gloria on call? Gloria, go ahead.
Yes, good afternoon. My name is Gloria Damalekun. I'm a Hamid liaison. Sorry, you're not able to see me. I'm still battling to make sure my camera is working. I'm sure before the end of the lecture, I'll fix that.
Thank you so much, Gloria. We don't have Evelyn today, but Jordan, would you like to introduce yourself? Do we have Jordan? I see, Jordan, you're on call. Would you like to introduce yourself?
Hi, yes, my name is Jordan Stanek. I'm currently working in the capacity of a corrections liaison, WIT liaison, and also stepping in as HAMIT liaison. I'm responsible for all corrections facilities, any workplace facilities, and also stepping into the role, assisting in any HAMIT relations that I may.
Thank you so much, Jordan. Is there anyone else on the liaison side who would like to introduce themselves before we proceed further? Okay. We also have our awesome outreach team, Jasmine and Kemi. Would you like to introduce yourself?
Hi, good afternoon, everyone. My name is Kemi Salu. I'm actually part of the Office of Epidemiology, Surveillance, and Emerging Diseases. I am the Health Equity Program Manager, so I'll be sharing a slide or two along with Jasmine.
Thank you, Kemi. Is Jasmine available?
Hi, everyone. I don't know if you can see me, but my name is Jasmine. I am the Resilience and Recovery Specialist for, along with Kemi and the Planning and Strategy team. So we will be sharing some information for you guys today.
Thank you so very much for your time. We also have other long-term impact EPIs and other epidemiologists from Harris County, just in case you guys have any questions towards the end. So for starters, the goal for today is going to be talking more about long COVID, how it pertains to your facilities, how you would be able to take care of situations where you identify long COVID. And in addition to that, I also want to bring to your attention resources that we can offer. Those resources can include free on-site assessments. We can come to your facility, look at the infection prevention strategies, provide guidance to you in terms of those, and work with you for those purposes. In addition to that, we can provide PCR testing, vaccine clinics for your sites, where we can schedule the clinic for you and then proceed to an on-site visit for those purposes. And finally, also the town halls. So this is one of the many town halls that we will be hosting. We will have another town hall next month. If you have any particular topics you would like us to discuss, we can go ahead and add that to our rotation as well. Town halls would be an hour. The best time right now identified is Friday at 2 p.m. But if you have a specific day and time you would like us to host, we can do that as well. Also, one last reminder, in case you're sending us line lists for outbreaks for your facilities, please make sure you are reaching out and sending the line list to MDT with requests. The email is right here, and CC your liaison. Our current liaisons are Evelyn and Gloria. Again, Evelyn is not in office today, but Gloria is available in case you have any questions. So the topics that we will cover today include an overview of long COVID, any pertinent risk factors, the common symptoms, the health impacts that you would see, treatment options available, and resources and recommendations for long COVID. In addition to that, we have our outreach team. So we will be covering community resilience and recovery, health equity, and answer any questions you may have. So let's talk about long COVID. What is long COVID? Long COVID is a condition that can also be identified as long haul COVID, post-acute COVID-19. It can be referred to as PASC, which is post-acute sequelae of SARS-CoV-2 infection and long-term effects of COVID-19. It goes by various names. And one thing to keep in mind is all of them are referring to long COVID. According to the CDC, any symptom or health issue that develops or persists over 4 weeks, which is more than 30 days after your first or initial infection, can be identified as long COVID. It can have various shapes and forms. So you may present with a variety of symptoms, and the symptoms may not be same amongst individuals. So there are certain key factors you may want to keep in mind. So there are a variety of complications that can last from several weeks to even a year and longer. And these are some topics that we will discuss today to talk about the effects of long COVID. Anyone who has COVID-19 can get long COVID, even if you've had no symptoms or even if you've had mild illness. Individuals with comorbidities include obesity, which is a top one, and diabetes and cardiovascular disease. Those who've had severe COVID-19 infection are more likely to get long COVID. So hospitalizations due to COVID, any systemic infections due to COVID can increase the risk of getting long COVID. What is the prevalence? 1/5 of the population who's infected with COVID is currently being identified to get long COVID, which comes up to about 15% of all US adults that have developed long COVID. Prevalence estimates vary, and it can depend on the variant. So it can go between 5% to 50%. I have some statistics for you. So in Texas, currently, according to the data we have, about 14.6% of adults who've ever reported COVID are currently experiencing long COVID symptoms. Children can also get long COVID. So It just depends on what your underlying comorbidities or health conditions are and what you can expect out of it. As you see on this graph to your right, the cumulative number of cases for individuals who are surviving post SARS-CoV-2 infection, which is COVID-19, we have about close to, I can say, about 8 million infections. Keeping that in mind, we have about 2.3 million cases estimated in United States that are known to have long COVID. When we zone into these facts for Harris County, which is where we reside, so it's extremely important for us to know which conditions we are living in. We have about over 1 million people surviving past COVID. That's the total number within the county. Harris County is the third largest county in United States, so these numbers are pretty solid and pertinent to what we need to focus on. In addition to that, we have an estimated number of long COVID cases, which is about 170,000. This is a huge number, and this ensures we need to make sure that we are focusing on long COVID to see how we can combat the effects of it. So now that we understand what long COVID is, it is also important for us to understand how to diagnose long COVID. Unfortunately, because it's affecting multiple systems, at the moment, there's no single diagnostic test. Symptoms can be very hard to explain and manage, and that would also go back to the age group that we are referring to. So the symptoms may be different for an elderly population versus a young adult in comparison to a child. Diagnosis can be made by clinical history and physical examination, but it would require a solid multidisciplinary team of healthcare professionals who can be there and help us in terms of the process of diagnosis. Clinical evaluation can include a variety of tests, so it's not going to be just one blood test or one go-to method. It can include blood tests, we can have chest x-rays, electrocardiograms, and all of these will be dependent upon the comorbidities or the underlying health conditions of the individuals who have been diagnosed with COVID-19. As of July 2021, long COVID is actually a disability. So it's a real thing. And it is considered as a disability under the Americans with Disabilities Act. Let's talk about the risk factors. Increasing age, so primarily individuals who are over the age of 65 have a higher risk because that's our vulnerable population. If a person belongs to the female gender or is born as a female, they are more likely at a risk. If one gets severe disease, they are hospitalized with COVID or they were in the ICU with COVID, that's also an increasing, is also a factor that can increase the risk of long COVID. Additionally, vaccination is extremely important. So individuals who are vaccinated, unvaccinated or under-vaccinated, they are at a higher risk. It is known that if you are up to date with your vaccine, and even if you are to get COVID, then the severity of COVID is reduced, which means the prevalence of COVID, long COVID is reduced. If an individual has pre-existing comorbidities, as we discussed earlier, if they are diabetic or if they are obese, that's also a problem. And then we also must consider the fact about racial and ethnic minority groups. If an individual belongs to a minority group, then in that particular situation, they are also at a higher risk of COVID, long COVID. Let's look at the symptoms. We have the top 5 symptoms listed out here to the right of the screen. They include fatigue. So 58% of the individuals are complaining about being tired. We have headaches. So 44% of the individuals, they've had a headache and they can constantly state about having a headache. brain fog is also one of the top factors. You may not have considered alopecia or hair loss as one of the factors, but yes, that is one of the factors of long COVID. Individuals who are identified with long COVID have reported hair loss. And then finally, we also have shortness of breath. Shortness of breath with the individuals who had COVID with respiratory symptoms and then eventually long COVID have reported that. We have other symptoms as well, and we've divided those symptoms system-wise. So as we discussed earlier, brain fog is one of them, cognitive impairment, which is likely among elderly population, and also stroke, because COVID is known to throw out blood clots and impact the cardiovascular system. So many individuals may experience stroke. Lungs, the common ones that we know include cough and shortness of breath. We have skin issues, so that goes back to bruising and rashes. Nasal or through your GI system, so loss of taste and smell, which continues post-COVID. Issues with the heart could include a pounding heart or heart failure. So cardiovascular issues are common. We'll talk more about that. When we talk about issues with the kidney, there is an increased risk of kidney injury and also kidney failure. Let's talk about the comorbidities. We touched on this prior. So we have diabetes, we have heart conditions such as hypertension, which is one of the major risk factors, neurological conditions, and also diseases that weaken the immune system. So if you don't have immunity to fight COVID, you're also likely to experience long COVID. Let's talk about the impacts of long COVID. Starting off with the cardiovascular impacts, give me 1 second. Starting about to talk about the cardiovascular impacts, we have higher incidence of cardiovascular outcomes. As I mentioned earlier, blood clots can be thrown out in the system for strokes. Those blood clots can also impact the heart. In addition to that, individuals can have inflammatory heart disease. Inflammatory heart disease is something that the individual will experience when there's inflammation on the heart. If there's inflammation on the heart, likely there's inflammation on other organs of the body, and with that you may see myocarditis and pericarditis. You may have heard about myocarditis and pericarditis. Myocarditis is when you have inflammation of the heart. Pericarditis is the lining of the heart, which is the pericardium. Cerebrovascular issues include strokes. So stroke is one of the top things that we may want to keep in mind, as it has come up several times. Dysrhythmias include various differences in the heart rhythm. So if they are tachycardic, if they have AFib, aflutter, those are the kind of things that could help in those situations to keep an eye out for. Cardiac arrest is heart attack. So when a person has a heart attack, it can lead to an increased mortality depending on what interventions are taken. So if a person is reporting chest pain, then that could be something we want to keep an eye out for. And then thrombotic disorders, which also goes back to what we discussed earlier with clots and the veins. Okay, so moving on to the respiratory complications. They include shortness of breath, as we discussed earlier. In addition to shortness of breath, we have chest tightness and cough. COVID-19 can affect one or both lungs. So depending on the severity of the disease, depending on which lung has been impacted, we may see symptoms accordingly. In addition to that, 20 to 30% of the critically ill patients can develop blood clots because now it's impacting multiple systems. Infection damages the walls and linings of the air sac in about 5% of the cases. In addition to that, there are other things we may want to keep an eye out for because COVID-19 gives a direct hit to the lungs. So we have an image here that goes over various aspects of the lung. The very first image that you see out here is your healthy normal lung. This is what you want it to look like. This particular image of the lung is the image of a 50-year-old man. Moving on to the second image, you start seeing gray patches here, right? So these gray patches are basically showing there are mild respiratory symptoms. The worse it becomes, you will see a larger amount of gray patches. So as you see in this image, the number of gray patches have gone up. This is a clinical model of a lung of an individual who, though he recovered from COVID-19, he still has a clinical suspicion that is showing that there's something going on with the lungs that we may want to keep an eye out for. Moving on to this image right here, as you see, evidently there's a clear change in the way the lung looks. So the lung model right here is of a 55-year-old female, and this person was diagnosed with severe respiratory symptoms and acute respiratory distress syndrome. If you don't know what ARDS is, it is basically a condition where the sacs of the lungs are filled with fluid, and that is what is changing or leading to the change in structure of the alveolar sacs, which is what is providing oxygenation to your body. This image right here is a straightforward image of the skeletal system covering the lungs. And finally, we have this image right here, which is image number F. This is looking at ARDS tissue, which has made it translucent to demonstrate the full effect. So there are opacities in the lung. You're seeing consolidation. You are seeing infection, and the ground tissue has become opaque, which is causing issues with not only breathing, but also the overall survival rate of the individual. We covered these images, but there are other complications that you may see. Individuals may have general inflammation or pneumonia in the lungs. There are individuals that can be co-infected with other diseases such as bacterial infections. We spoke about ARDS, but if the infection is to spread to other areas of the body, we may see sepsis. And then, of course, with these issues that we are seeing with the lungs, we may have reduced diffusion capacity, interstitial lung disease, and pulmonary fibrosis. Okay, so we spoke about the heart, we spoke about the lungs. It's also important to look at the neurological complications. Nerve damage will happen. We may see peripheral neuropathy, cognitive impairment, as we spoke about it earlier, which can lead to altered mental status. And this can impact individuals, primarily the elderly people who are more likely at the risk of dementia and Alzheimer's. Brain fog is common, headaches and lightheadedness. In addition to all this, sleep problems and insomnia will also be seen. There are individuals who may complain of numbness and tingling in their extremities and loss of taste and smell. Of course, stroke has shown up one more time, which shows the importance of identifying and making sure the individual is healthy and providing the appropriate care just in case an individual is to get a transient ischemic attack or stroke. In terms of the gastrointestinal complications, depending on the type of bacteria that is impacted in the GI system, you may see impacts on nausea, vomiting, loss of appetite, difficulty swallowing, as well as heartburn. These are the upper GI symptoms. When you talk about the lower GI tract, we need to keep in mind about symptoms such as constipation, diarrhea, or both. We may notice irritable bowel syndrome and also incontinence. Incontinence may be common among older adults. Mental health is extremely important. It is known that individuals with acute COVID, about a fourth of them have seen an experience with post-traumatic stress disorder, especially ones that were hospitalized due to COVID. In addition to that, we have insomnia, brain fog, social isolation. So depending on the health of the individual, isolation may be common. There still may be taboo among those individuals who may not want to meet other people or vice versa, as well as nightmares. We cannot leave out the emotional aspect of it, as the pandemic has had a toll on many individuals, especially with long COVID. We've seen anxiety, depression, agitation, severe fatigue, as well as loss of interest. Loss of interest may go hand in hand with depression. Dementia, Alzheimer's, and psychosis, along with epilepsy, can also occur, but they are not that commonly reported. One other thing to keep in mind is among children, you may see a different effect. So you may see individuals being a little more fussy. Their symptoms may include runny nose, and we may have to have a different outlook when we are dealing with children. Of course, if you are looking at the system-wise impact, it's also important for us to look at the societal impacts. So in terms of the societal impacts, we have emphasis on health and well-being for vulnerable populations. So we need to look at the mental health aspect of it and also look at federal funding that can assist individuals if they are experiencing some issues like that. Staff education in long-term care facilities or workplaces is also extremely important, because these are the individuals, or you guys are the individuals who are actually taking care of the elderly or most vulnerable population. And the focus also needs to be on infection prevention. Now let's look at prevention and treatment options. So in order to treat or prevent long COVID, it's important to prevent COVID. So we spoke about vaccination a little bit, but in terms of medications, if the individual has been diagnosed with COVID, if they are being given Paxlovid within the first 5 days of symptom onset, it can be linked to a reduction, a significant reduction, 26% in long COVID. It can also lead to about a 48% reduction in deaths, because if you can prevent COVID infections, you can also prevent the deaths. And there's a 30% reduction in hospitalization up to a year from infection. An additional thing to keep in mind is Paxlovid has to be prescribed by a physician. So depending on the weight of the individual, whether it's an elderly individual or a child, the prescription may change. Exercise and healthy diet can also reduce the occurrence of comorbidities or the underlying health conditions. So staying physically fit can also prevent infections like COVID-19 and reduce the risk of COVID. And of course, vaccinations. The initial vaccination with the monovalent vaccine is extremely important. And then the follow-up vaccination with the bivalent booster is extremely important. The bivalent booster not only has the strain for the original vaccine, but is also known to have the strain for the Omicron booster, which is currently what's circulating in our environments. This will help us reduce the infection. And even if a person is to get infected, it will reduce the severity of the infection. It may also help alleviate some symptoms for individuals with COVID-19. Now, let's take a moment and talk about the treatment options. It's important to consult your PCP if you are thinking that you have long COVID or you're experiencing those symptoms. And then there are also options for long COVID clinics. So depending on the condition, Physical therapy and occupational therapy may be prescribed, olfactory training may be needed if they have loss of taste and smell, and of course, hyperbaric oxygen therapy. Depending on the condition they have, this can help with neurocognitive functioning, improvement in neurocognitive functioning. To live with long COVID, we want to keep a couple of things in mind. So the individual may want to monitor or take note of their symptoms, create a management plan, and also light movement and relaxation are important for their emotional health and well-being. We also have a couple of recommendations. In order to prepare for the appointment, it's important to have a brief history on hand so the physician knows exactly what they are dealing with, what the underlying conditions were, and what has exacerbated in the meantime. It's important to discuss their symptoms, identify what has changed over a period of time, maintain a list of medications. For example, Paxlovid is an antiviral. So if it is being given to someone who has HIV, in those particular situations, the effects of the HIV medication may go down, and that can be a problem. And finally, it's also important to bring a friend. Other recommendations can include reporting cases that are in your facility that have lasting symptoms for over 4 weeks from the initial infection. In that situation, our long-term impacts team can work with those individuals to see what else can be done. Please report the COVID-related hospitalization and deaths to your Harris County liaison because we are keeping a tab of what is happening in terms of hospitalization, outbreaks, and deaths. Resident socialization and visitation is also extremely important. So check with the HCPH hub, the data hub, which is basically giving you what community level we are at. Currently, we are in the green level, that's low community transmission, but this is also going to show you what the recommendations for your facility are going to be. For example, if you are in an indoor location, it's important to wear mask. The importance of vaccination and the vaccine clinics that are offered by Harris County Public Health. Staying up to date with your vaccines is also extremely important. And finally, I cannot emphasize this enough, improving ventilation. Opening of the windows, using the correct HEPA filters is extremely important. We have our vaccine call center and testing call center numbers that are available to you, but the easiest way for you to get this set up is to let your liaison know, and our team, including the team lead, Charles, will work on getting the vaccine and testing clinic set up so that you can have your organization's needs met. Also, we are coming up with a COVID-19 patient portal. So we are interested in hearing from people who've had COVID-19 illness and also those who've had long COVID. Everybody's experience is extremely important to us. That is going to help us give a segue into what we can do to help your organization and you. The COVID-19 portal will be up soon on the Harris County website. You see the QR code right here if you want to view it. And the portal has a link to report your long COVID experience. This is not going to take time. So it's just going to take about 10 to 15 minutes for you to complete. And it will give us the appropriate information we need so that we can take steps on our end. And thank you for your time. I'm going to hand it over to Jasmine and Kemi.
Good afternoon, everyone. I hope you can hear me. So we are currently working on a COVID-19 recovery plan, and that is been a long time coming now that we've been in COVID-19 response for a long time. We've just been responding to COVID, but now we are going to focus on building resilience in our community against COVID-19. So what is community resilience? So it is the ability of a community to use its own assets and to strengthen public health and healthcare systems. So with that being said, I am excited for this recovery plan, and I hope to hear from more community partners such as you guys if you have any opinions and any feedback on how we can include you on this recovery journey. Please feel free to reach out to us. I believe our information is going to be towards the end of this PowerPoint. So like Alicia was saying, everybody's feedback is important. So we do want to make sure that we include everyone in the recovery. So I'm going to hand it over to Kemi.
Awesome. You can change the slide, please. Great. So before we end this slideshow, I just wanted to talk really quickly about health equity and how this kind of ties into long COVID and the recovery plan, like Jasmine mentioned. So my role as a health equity program manager, just making sure that whatever plans and strategies that we do have to impact the community and our partners, we're making sure that it is equitable. And so we've had a vaccine incentive program that we had back in 2021 and early this year, which was a vaccine partner incentive program, VPIP, which was a way to give cash card or gift card incentives to the communities who received their first dose. We've also given away antigen testing kits to community members who are part of our VPIP program, as well as schools and FQHCs who were involved in our program. Another element of health equity is making sure that our messaging is diverse. We want to make sure that our images and our words reflect those of the community here at County. And another aspect that's important is to just continue to grow in our transformative relationships and not have a transactional relationship. Throughout the response, we realized that we heavily rely on our partners, and so that means that they should also be able to rely on us. And so just building those relationships with them is really important in health equity. And then lastly, but not least, is utilizing data. One of the ways that we do use data to inform our approaches and our strategies is by monitoring zip code data. So we look at the zip codes in Harris County that have high incidence, whether it's COVID-19 or any emerging diseases. And as our program or as our office continues to have surveillance over different emerging diseases, our needs or our desires to help the community still remains the same. So if there's any other questions about health equity and how we can meet the needs of your program or community organizations, I believe my email will be located at the end of the slide. So thank you so much for allowing Jasmine and I to talk about community resilience and recovery, as well as health equity. And thank you, Alicia, for your presentation.
Thank you so much, Jasmine and Kemi. I appreciate you guys coming and presenting to our facilities. Do you guys have any questions for us? I don't see any in the chat right now.
We don't have any questions from Lawrence Street.
Thank you. Thank you so much. Does anyone else have any questions? Okay. I do not see questions in the chat, so I guess we can wrap up earlier, and our next town hall will be next month, same time, Friday from 2 to 3. As soon as we schedule the meeting, we can let you guys know and we can go from there. Thank you so much. We appreciate you guys joining the town hall.
Thank you.
Thank you.